for them to produce face masks, paid off all their loans that they had with the banks. So this is the government putting its money where its mouth is, supporting its own to make sure that we deliver. So within the Ministry of Trade and Industry, under the all-government approach, we ensured that we delivered the PPEs to allow us to get on top of, as we said, but not defeat, to get on top of this pandemic, and we'll continue to do our part as this fight continues. Thank you very much for your time.
Honourable Minister, thank you. I want to go back to the numbers. You know, sometimes we gloss over these numbers and we take things for granted. I just want to go back to your numbers as you share them with us, because you will recall at the beginning of this battle, the challenge, one of the major challenges was our ability to A, cut spread by having a lot more people wear masks, and B, help ensure that our medical personnel in particular would have the head covers and the scrubs and the face masks to avoid infections in the hospitals. You watched on television, listened on radio to stories of many countries where healthcare personnel were being infected in the tens of thousands, and it was beginning to have a toll on their ability to provide healthcare. This is what your country, Ghana, did or has done so far, and intends to do some more. And it's something that I think all of us as Ghanaians can be proud of. Over 18.8 million face masks produced here in Ghana. Over 90,000 hospital gowns. Because if the world was running short of such supplies, and all that government was doing was complaining that, well, it's in short supply, it's in short supply, it's in short supply, we may have more infections in our hospitals. But 90,000 hospital gowns, 90,000 head covers, 60,000 medical scrubs, over $16 million of foreign exchange savings, etc., as a result of these interventions led by the Ministry of Trade and Industry. And it has been a major contributor. It has been part of the pillars that have contributed in changing the way Ghana's outcomes have been so far. I think we can give our colleagues from Trade and Industry, our colleagues in the various factories and organizations that did the production, we can give them a big round of applause. Honourable Minister, thank you once again for that intervention. I just want to reiterate that we are live on Ghana Television, Net2 Television, GH1 Television, Home Base Television, Metro Television, Asempa FM, Oman FM, ETV, Kesben TV, Wuntumi TV, Adom TV, Joy News, Happy FM, Asasi Radio, and MX24. All of these interventions have cost money. And we've spent a lot of money on a number of initiatives. But key to the interventions have also been the public health interventions. I want to invite Dr. Patrick Umabwaje of the Ghana Health Service to quickly join us upstage, run us through some of the key public health interventions that they have had to put in place to help us get to where we are now. And then I'll invite the Deputy Minister responsible for health, Abna, to join us. And I've reshuffled you, and forgive me, the Deputy Minister of Finance, Abna, to join us and tell us about the things that we've been spending money on to get us these results. Dr. Patrick Umabwaje, please join us.
Thank you very much, Honourable Minister. I think I can call you a COVID expert already. Honourable Minister of Information, Deputy Minister of Finance and Trade, and Presidential Advisor on Health, fellow colleagues and ladies and gentlemen of the media. My work is very simple. It's basically to run through the key things that the Minister has ably summarized on how exactly these activities took place. Our current situation, I can summarize a total of positives of 47,461. We've had 312 deaths coming out of becoming about 0.66% of our deaths compared to a global average of about 2.5 to 3%. Total number of recoveries, about 98% of all these people have recovered. We have carried out 512,523 tests, bringing it to 17,066 tests per million, which is one of the highest if not the highest in Africa. Our cumulative positivity rate is 9.3. And I'll also take you through the next slide, which gives you the moving average of our 7-day moving average of our number of cases. And you can see that if you look at the epic curve the minister showed, you can see that on the same trajectory we moved up and we have come down and we have stayed down in the last 5 or so weeks. We have moved from a positivity rate of nearly 30% around middle of July to a current level of about 5%, which also shows that the disease is really going down and that we are really ahead of the disease, but of course, we are not over it yet. I'll focus more on 4 key areas of the 6 priority interventions that was set out as the beginning of the thing, following all the structures that put in place, the coordinator, the Presidential Task Force, the EOC, and the NTCC. We came out with this. The first was to limit importation of the cases. Secondly was to detect and contain the cases. We also slow down community spread, and finally, how do we manage the cases? So my presentation will look in that direction. So first, looking at the limitation and stopping the importation of the cases, what did we do? I think Ghana started quite early. Until then, we were more in a preparatory mode, and then the first case came up on the 12th of March. That's when we moved into the response mode. So preparation and response are clearly different. As part of that objective was the training of port health and non-port health staff in terms of customs, national security on the disease. We also used the terminal scanners. When other countries were not doing anything, we were using terminal scanners to scan everybody who got into our airports. Thirdly, in the declaration form, we gave out the information as to exactly where have you come from, what is your risk profile, so that we'll see how to manage you, whether we should follow you up, among other things. We also followed up with the government advisory that people should not visit certain countries where at that time was very high, Italy, China, etc. And also, we also followed up with a restriction of entry for any country that had recorded more than 200 cases. I'm sure if you look at the numbers we are having now and the numbers we're mentioning, that you realize we started with a real caution. 200 and you can't come into Ghana. We were all banned, all officials were banned from traveling outside the country. Not only not to go and import, but also to ensure that we stay back and do the work. The closure of the borders, as I've been mentioned, air, sea were all done, and then introduction of the mandatory quarantine. These were all part of the intervention to prevent importation. The mandatory quarantine involved initial testing, daily monitoring of signs, etc. And then on a particular day, the minister mentioned 1,030 passengers who arrived on the 22nd and 23rd of March were quarantined in 15 hotels in this country. This was something that is unique. That's the only country that had done that. Of that, about 79 and 26, first and towards the end, tested, about 105 of them tested positive. As part of that, intervention has been along the chain was the evacuees who had to come in. Either they were deportees or Ghanaians who wanted to come or who needed to come. We had over 8,000 of these people already brought into the country, tested and quarantined as part of the measures to prevent importation of the disease. We needed to ensure that our ports of health is very active. Currently, of the 44 entry points that is manned, Port Health is only on 22, and that's something we need to expand. Port health actions are taken at the other places where we have immigration and customs assisting us do the job. We have provided logistics and face masks, sanitizers, and contact thermometers to the Port Health staff across the country, and having actually expanded Port Health to cover not just the health, but also the local airports. Kumasi, Tamale, Wa, they all have Port Health staff there as we speak now. And this was done until the KIA was opened on the 1st of September. What was the preparation for the opening of the KIA? I think there's a lot, but I can sum them up in We had to provide operational booths for Port Health, 12 at the arrival and 2 at the departure. We had the installation of electronic system for the health declaration forms, workshop with airline operators and guidelines on safety, and also we had simulation exercises before the airport hosting to ensure that all these things we are going up under real circumstances, how is it going to operate, and that's all things were done. We had to do something very, very important. See, Port Health originally had been established more for environmental health. We have to move from environmental to human health because of the situation we have and the subsequent pandemics that we have been having from Ebola and that thing. So this gave an opportunity to move from environmental to also human health. And based on that, about 32 additional staff have been fired. Doctors, nurses, disease control officers, and clinical psychologists are part of the Port Health team currently. The next slide just shows us a picture of Port Health before the pandemic. That is just those of you who have been there, you see the screen, that shows you right when the temperature is high. To the right side, that shows you that now Port Health with booths, thermal scanners, and digitized Port Health currently exists, and we hope to do that in all the other sites that are coming up. We have moved our health declaration form from paper to digital, and so that also is something that makes it, that's how we are able to move things very fast at the airport, despite the fact that we are testing. We also have developed a holding bay where people who fall sick, who are tested positive, are also held to make it more complete and not to inconvenience travelers. You can see the picture, those of you who have seen the pictures of the new labs, that the booths where samples are taken. On the right is the new lab. This is one of the 2 labs at the airport that's allowing us to do all the things we are doing. So other surveillance activities we are doing are the completion of the electronic data form, completion of PCR results of country of origin, arrival, etc. Temperature checking is still taking place, and isolation and transfer of those who are positive to the designated facilities, and contact tracing. And what we must also remember that we are not just testing. Anytime anybody tests positive, we look at 2 C's around you, and all those passengers are contacts, and we do well to contact everybody and follow them up until they are safe for the first 2 weeks. So to detect and contain cases, case detection was very important. How are you going to identify the cases? We developed a case definition as to what constitutes COVID. We developed a surveillance and contact tracing guidelines, training of health staff, and implementation of guidelines. We also started an enhanced contact tracing implementation strategy was developed, and also had call centers that was also giving us information on contacts, people who are sick, to allow us to respond appropriately. The regional response teams were trained and operationalized across the country in all regions, and in all the 260 districts were operationalized. SORMAX, which is an electronic database, was also scaled up nationwide. In Ghana, I can tell you that we are probably one of the very few countries that are doing e-surveillance, which means that whichever district you are, as soon as you are tested, it goes through the electronic system, and all those who need to know exactly who is positive, what's your name, what's your age, where are you, where's your geographical location, so that we can have a quick response. So the next slide shows you the SORMAX, Surveillance Outbreak Response Management Analysis, and I must thank GCNet and the German government for the support they gave us in this infrastructure. We also developed other applications like the website to inform Ghanaians. We also had other applications like COVID Connect, which was more of a treatment application, the tracker to see who has become across a positive case, and we're able to help you do that. So we have the RGIS, and so we should know exactly where all our contacts are, all our positives are, and so that we are able to trace them. And of course, the partner BIOS, which we started recently, which is going to give us a national database that if negative, there's a database that can verify I'm truly negative and not just and that is something that we as a country have started first. If other countries join, it becomes a more and more useful system for us to use. For enhanced contact tracing, the strategy was to extend the spread of the high community in high burden regions. The partial lockdown, which was 3 weeks, has been mentioned already. Teams were resourced and deployed to test, track, and link cases to the care. In the lockdown period, in that short time, we did nearly 200,000 tests were done in the 3 weeks that we had. And multi-sectoral contact tracing involvement, national security, as we mentioned, immigration were all part of the team that helped us do the work. At early in the month, we engaged the transport agencies, VIP, STC, and among others, that please make sure you are taking contact details of all your passengers so that should there be any case, we are able to track them. I have a few slides, pictures on how the GIS shows you where our positives are, and it's a multidisciplinary team, immigration, health workers, others, and national security being part of the contact tracing team that got. We've always had a lot of questions about testing strategy. You are not testing enough, you are testing too much, it's delaying. The mainstay of our test was the PCR. Initially, we were testing based on case definition, so there were few. If you are sick, we test you. Then we move into testing close contacts, not all contacts. And then we move to enhanced contact tracing during the lockdown so that all contacts are tested. We also did a perimeter screening to see where is the community spread. And we also continue on that, and only a very few of that have currently changed. That's the only perimeter has changed. The rest still remains what we are doing. The initial PCR and double exit was changed to no exit, and that allowed us free our borders, our hospitals of people who were healthy but were waiting for a second test. The RDT, with evaluation of a lot of RDT has been done. I know there's a lot of talk about RDT. What we are going to do is that now we've done this antigen test, which we are using at the airport, the immunofluorescent assay testing for the care, which gives us excellent sensitivity and specificity. But we plan to use RDT for seroprevalence surveys across the country to give us our people how safe are we and what we need for planning purposes. Currently, our testing capacity has moved from 2 centers, KCC and Noguchi at the beginning, to about 16 more. And it's going to move to about 26 in the next few months. In fact, by next week, we have 2 more labs in Nkrumah and Takwa to join in that. And so if you look at the next slide, the map on the chart shows you all where our maps are, and you can see in the next slide where all the positive, all the labs are across the country. In addition to that, we have the gene expert, which is being placed specifically in specific hospitals like WA and other places, so that people who are sick can be tested quickly. For containment, facilities have been designated holding rooms, was done. District assemblies provided quarantine facilities. Mandatory was also implemented as a quarantine. Mandatory when condition of the quarantine has not been met, we have put you, the self-quarantine is when we put you in mandatory quarantine. We had designated isolation centers. Currently, PCC, which are largest, had actually held about 3,000 plus since the beginning of and we have all these centers providing care and isolation for us. How did we slow down the community spread? We slowed down community spread, and all this have been mentioned just about that. By the ban on social gatherings, lockdown was part of the social distancing measures were put in place, restricting gatherings on funerals, the passage of law on mandatory wearing of masks, disinfection of public places and markets, schools, institutions, and risk communication strategies was also put out, part of way of slowing down the spread. We also had a rapid response team outside the district teams that responded actively to emergencies. And those of you who remember, we had the outbreaks in Tema, Obuasi, Takwa, Asankregwa, Kumasi, Lower Menya, some schools, and for those who don't know, even some of our oil rigs, we had to quickly mobilize these experts to quickly go and contain these conditions. We also work with our academia, including the Ghana Academy of Arts and Science, to provide model and advice for us. We also put some of our old experts and professionals to go and mentor all the regions, and 16 of them were placed in the region to do just that. We did the risk communications, had taken place a lot, and I don't think we should just take too much detail, but these are some of the things that were done in terms of risk communication, flyers and papers were producing. We had a TV, among others, and we also had, as part of our communication, a daily situation report from the district all the way to the national level, which was shared to all. Of course, the presidential broadcast is part of our communication, assisted a lot in cementing our risk communication. And we had a lot of stakeholder engagement, the National Council of State, Parliament, traditional rulers, regional organizations, industries, MDAs, among others, were all part of the team that we met. So these are just pictures to show. What was the case management? Preparation for providing healthcare, appropriate health medicine was important. Staff training and capacity building took place. Development of case management guidelines was taking place. We moved from 13 beds from the beginning, that's 8 in Tema and 5 at Ridge at the beginning of the pandemic, to nearly 1,000 beds now as we speak. Provision of equipment, ventilators have been provided, expansion of isolation centers have been done, and inclusion of clinical psychologists also became one of the early interventions that we brought in to mitigate the effect on people. So we have done a lot on case management. Home isolation is one area we are actually currently focusing on. Next slide. If you can go to the case management slide. Yes. And so a lot of this, oxygen therapy, ventilators have all been brought in. Of course, the ambulance has also brought in to improve referral. If you look at infrastructure, I can show you a few pictures of some of the key infrastructure that have been, these are treatment centers that have been built in the Fantine area. Yeah. You have the availability of the 300 plus ambulance at the time was very, very timely. It helped able to quickly move people to the sites. And I remember one central regional director calling me, DG, I have only 5 ambulances. It's not enough for me. You can imagine where we have come from. So it came about. We're linking up schools to DHMTs and the school infirmaries became very crucial when school reopened, and that was how we were able to look at that. We worked a lot with NIA and election as a health sector to prosecute this agenda that they had to do. I think I'll leave some of the governance issues. The minister has already talked greatly about it. And one of the main infrastructure that has been is that as part of this has been the rush and the force to expand and complete our EOC building, which is the main nerve center for COVID, for any pandemic response in this country. And then the team is moving in next week, and the place is fully ready for work. We have done a lot of research on people, hydroxychloroquine, people who are, as it were, who are asymptomatic. Who are they? What is it about them that they are asymptomatic when others are sick? These are all things that has been done. Some of the lessons learned, I think we can do that. Improving access to testing can help us go ahead of the virus, and I believe that that's what has really pushed us ahead of identifying, isolating, and being able to bring the pandemic to a close. I mean, not to a close, under control very early enough. Adherence to practice has been very helpful. The nation's capacity to manage critical respiratory conditions has been expanded as a result of COVID. And the rapid mobilization and deployment of health workers has been very, very helpful. And timely availability of the 300 plus ambulances has been a major game changer for us. And some of the lessons learned that when we started, we had asked our Deputy Director General to focus on the other things. And so we started how to manage the other cases without losing them. And in all that, I can tell you that as at half year, antenatal coverage had actually gone up. We have had reduced number of stillbirths. EPI coverage has reduced only slightly, but we are catching up. Diarrheal disease has significantly reduced from 1.1 million to about 700,000, nearly 30% reduction. And that is because we washed our hands, we did social distance. And so these are things that we must keep. because they have overarching this thing for us. And we have not reported any case of cholera this year, even though cholera is endemic in Nkrumah and Accra, and there's no way you will not report one. So these are some of the good things we have. We have also known that managing non-communicable diseases is very important because of what COVID has showed us. And I want to use the opportunity as I close to thank the national team, the president, the other ministers who provided the leadership and the guide and the push for us to do what we did, members of parliament, academia. Our health partners have been very supportive, both financially and technically, the media, traditionalists, and the general population. Thank you very much.
At a point, he became everybody's doctor, Dr. Patrick Kumabwaje. Let's celebrate him with a big round of applause. One of your slides I take keen note of is a slide that shows, may I say, the positive unintended impact of COVID and the interventions, a reduction in a number of other conditions, and the fact that, for example, cholera, which is endemic in Accra and Kumasi, as a result of the improved personal hygiene, we have not recorded a case of cholera in Ghana in this year, 2020. So there have been some positive parts to this enterprise. We have just about 30 minutes to wrap up. A number of things will happen in this 30 minutes. The Honorable Abena Osei-Asare will tell us about what we've been spending money on. Dr. Nsiah-Asare will tell us about the next steps. And then we'll show you a little documentary before we end on some of the things that have already started as part of the next steps. My job is just to speak very briefly to some of the underpinnings in communication that we have used during this enterprise. To get an all-of-society approach, it means that the entire society must sing from the same hymn page or the same hymn book. And so what we needed to do was to create a lot of heavy public awareness from day one. What we also needed to do as part of creating public awareness was to have a high level of transparency. And so you recall that initially the media was reporting, we've had this one case here, we've had this one case here. We now had to roll out a website in collaboration with our colleagues at Risk Communications, Dr. Da Costa and his team. So now the Ghana Health Service website created a dedicated page where in real time they could be updating to avoid all of that misinformation and miscommunication that was coming in. We also had to now work heavily towards fighting falsehoods and quickly responding to narratives and fake news. And I want to celebrate our colleagues in the media. You have done a yeoman's job in helping us to ensure that the right information was put out there. We cannot thank you enough, because the work that you have done as media practitioners, you didn't look at it as time for competition, time for breaking news, etc. But you looked at it as an opportunity to join in a national exercise to provide the right information to the Ghanaian public so that we could all be forewarned and forearmed. The President himself took charge Sunday evenings with his national updates, which many of us looked forward to hit some of the high notes. We, those from the village, we say, Assembly Oha is a Chiamiano, Assembly Oha is a Ohena Nkasano. And the President himself did that on Sunday nights through his fellow Ghanaian addresses, which he still does. I think it's done the 18th update, but it is part of the exercise to provide awareness and transparency. And in these days where we notice people are getting complacent, draw attention to the risks that are out there, particularly the risk of a second wave and how to deal with it. I want to also thank a number of agencies, the health workers and health-related agencies. You've done a fantastic job in helping us save as many of these 47,000 lives as have been saved so far. The security agencies that helped us also to do the initial lockdown so that we could know the dynamics of the virus. We want to thank you. And I want to also thank all of those who availed their buildings to be used as isolation centers. You remember some of them were being attacked initially. I'm sure you recall. But as time went on, we saw from the Soccer Center, JFA, the Pentecost Church, and many other places, other hospitals with high intensive care beds that made them available. I want to thank all of you. I want to show you a photo of a gentleman who refuses to make public appearances, but he has been a very, very, very key pillar in this battle. I know picture up, but this is the coordinator of the response program, Dr. Asamoah Ban, who has been working in collaboration with the Office of the President and has been helping and guiding and advising to get to. I think we can give him a bigger round of applause than what we have done now. He's been key to what has happened. At this stage, we have 3 more things to do. Talk about the money, talk about the next steps, and show you how the next steps are beginning to unfold. Let me invite the Member of Parliament for Etiwa East, my sister, the Deputy Minister for Finance, the Honorable Abena Osei-Asare. Let's welcome her to the podium.
Thank you very much, Honorable Minister, and good morning, fellow Ghanaians. The previous speakers have left off. I'm doing this on behalf of the Minister of Finance, who is also at the African Free Continental Trade Conference. And so let's go to slide 4, because most of the things I had in the previous slides have been mentioned. There's a question that people keep asking, that how has Ghana been able to manage the COVID-19 pandemic with such spectacular health outcomes? Forgive my voice, my voice campaigning. And to answer the question on how we were able to achieve such spectacular outcomes, I would first like us to look at the socio-economic impact of the COVID-19 pandemic. So we move to the next slide 5. Slide 5. We all know that precious lives have been lost in this pandemic. Livelihoods have been severely impacted negatively. Almost all the sectors of the economy were also impacted negatively by the pandemic. But as a result of the implementation of the restrictions, even our projected GDP growth was revised from 6.8% to 0.9%. The pandemic also affected our ability to even collect revenues. As a result of that, we saw local economic activity slowing down, and spending was not going on as it was supposed to be. But on the other side, we also needed to spend to curtail the pandemic. We had a couple of things that government needed to provide the health sector and the other sectors to help us fight the pandemic. So this saw us revising our fiscal deficit from 4.7% for this year to 11.4%. And we also had to suspend the fiscal responsibility rule, where we had a ceiling of 5% of our GDP for any fiscal year. We had to suspend that because of the additional expenditure that we incurred and the reduction in revenues as a result of the mitigation factors that we had to put in place. So, like I said, we had 2 things in mind: protect lives and protect livelihoods. We had to close the borders. And in closing the borders, we needed people to man these borders. And in manning the borders, they required funding. So government made funding available through the coronavirus alleviation plan. We had Plan 1 and Plan 2. The Plan 1 saw to it that as a result of the partial lockdown, we had some sectors of the economy being adversely affected negatively compared to the others. So the first thing we looked at was the household, individuals. And so government had to provide food, raw food, and then dry food, and then cooked food to some sectors of society or the economy. Government needed to provide money for this. Again, in terms of funding for tracing, testing, and treatment, the 3 T's, government needed to provide funding for that. And this was also done in the CAP plan that was sent to Parliament. Also, we had an influx of health workers. Immediately, government had to give financial clearance to enable the Ministry of Health employ about 24,000 health workers to help us mitigate this. And not just that, government also felt that the workers, the frontline health workers, needed additional boosts. So government also provided relief in the form of tax waivers and allowances for these frontline health workers. Again, we felt that we should take advantage of this pandemic to improve on our health infrastructure. So government also made available some funding in the Agenda 88, which increased to Agenda 111, where we are seeing that there's 6 new regions having new regional hospitals, and then districts that did not have health facilities also getting district health facilities, including my district, Etiwa East districts. Dr. Abuaji also mentioned that government invested in sanitation and hygienic things that has resulted in no recording of cholera this year. Yes, we have to invest in sanitation and fumigation, and this is something that government is going to do every quarter to fumigate the markets and the schools to bring down, diseases like cholera and any other thing that will help us also mitigate the effect of. All that I have mentioned here, can we move to the next? Yes. So this is what government took to Parliament in the mid-year, that we needed to have a preparedness and response plan 1 and plan 2. The plan 1 was what government, that was about 1.2 billion. And this government sought through the Ghana Stabilization Fund, where we keep our oil revenues. We went to Parliament to ask Parliament to reduce the cap. In that fund, we had about $300 million US in that fund, and we asked Parliament to reduce the cap to enable us bring it down to $100 million, to enable us use the difference. We had a little over 300 million, to enable us use the difference of a little over 200 million to fund some of these programs. So the first one that Parliament approved